Chair recognizes the lady from Kenton for explanation of the bill and a motion thereon.
Thank you, Mr. Speaker. It's my privilege to speak tonight on House Bill 2. House Bill 2 or Senate Bill 2, excuse me, is a bill related to healthcare actions to increase and improve the protections for Kentucky citizens during the state of emergency in response to the COVID-19 pandemic. House Bill 2 adds that essential caregivers, it's a bill that we passed last session, and is included and reiterated in this bill. It says that essential caregivers in long-term care facilities may work to relieve the staffing shortages and allow family members to help provide compassionate care to their loved ones. It will also increase the administration of monoclonal antibodies in the establishment of administrative centers throughout Kentucky. Monoclonal antibodies have been shown to be a life-saving treatment for COVID, which treats infected individuals and prevents them from falling gravely ill and overburdening our hospitals. This bill also assists various healthcare providers to obtain needed COVID tests and improves the ability of primary care health providers to obtain vaccines in their office for ease of administration should a patient desire one. Senate Bill 2 addresses the nursing shortage across the state and allows paramedics who are licensed to work in hospitals and nursing facilities under the direction of medical staff in these facilities. It also extends the provisions in House Bill 276, which allowed personal care attendants who were hired during the pandemic as temporary personal care attendants to apply the hours that they worked during the pandemic toward their state registration. It requires the Cabinet for Health and Family Services to partner with healthcare professionals to produce educational public awareness campaigns on the effects of COVID and efforts to prevent and mitigate the effects of COVID. Section 9 in Senate Bill 2, allows conscientious objection to vaccines should the health department put these orders in place. And later in the bill, we discuss the lifting of the statewide mask mandate on healthcare facilities and another regulation that addresses the statewide mask mandate for everyone. These two regulations were found deficient, and so this restates the Administrative Regulation Review Committee's the finding of deficiency and officially nullifies the administrative regulation. It does the same for both of these regulations. It also states that in both of these regulations, the administrative body shall be prohibited from promulgating an administrative regulation that is identical to or substantially the same as this administrative regulation until June 1st of 2023. Mr. Speaker, if there are no questions, I move passage of Senate Bill 2.